I'm I'm just switching the network.
Shall we start, ma'am?
Yeah.
Okay. So I started from
Hello.
the beginning again. Hello.
Hello, Dr. Apurva. Hello.
Hello, everyone. A very good afternoon, everyone. Thank you so
Can
much,
you
all the
see me?
panelists.
Hello.
Yes, sir.
Hello.
Hello.
Your voice is breaking.
Hello. Am I audible? Am I audible to everyone?
Shakti, can you hear me?
Yes, ma'am. I can hear you.
There is no power and Wi-Fi problem at my place actually. The technical hitch here in my
Okay.
area.
No problem, ma'am. No problem. I think Purva sir has lost connection once again. So once he is back, I think we can start.
Yeah. हाँ सुने हाँ सुने
Hello.
Hello. Yeah.
Okay. I think
Yes,
we had
Shakti,
got
please
off.
start.
Yes. 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 Okay. So a very good afternoon,
Please
everyone.
start.
Uh, there was some connectivity issue, so I'm going to start it fresh once again. I welcome you all to this event that we have organized on behalf of Janitri on World Physiotherapy Day. Today is a day when we as professionals are celebrating our achievements, I can say. And you all have joined us to celebrate
Shakti,
World
there is a mic issue, I think. I cannot hear you properly. Is she audible? Shakti?
Yeah,
Yeah,
I can.
Dr. Shakti is audible.
Okay, I think okay, in my connection only. Okay, you can.
So we at Janitry have come up together to spread some word of awareness and wisdom about the importance of physiotherapy in the society, and now mostly focusing on the contribution that they have made towards the COVID-19 patients. We know that this COVID-19 has taken a lot of lives within this 1 to 2 years. And to just reduce the current scenario of COVID-19 symptoms, the multidisciplinary team, which comprises of all the medical fraternities along with the physiotherapists, have come up to fight and battle this virus. So in this team, our physiotherapists have played an immense role and has worked as a frontline barrier to save many such lives. So we have today with us Dr. Apurva Kumar Bora sir, Mr. Vijay Kumar sir, we have Mrs. Rumi Vora ma'am, we have Dr. Pallavi Goswami and myself Dr. Shakti. So to begin with, we have Dr. Apurva Kumar Bora sir, who is HOD Narayan Hrudayalaya Hospital, Guwahati, having more than 2 years of experience in treating COVID-19 patients. So without taking much of your time, sir, I would like to request you to take the podium and start with letting us know some highlights about the importance of physiotherapy and how they are working to along with the other medical fraternities to battle this virus. Over to you, sir.
Mm, uh, Good afternoon and very happy Physiotherapy Day. And I'm very obliged and privileged to say something on this auspicious occasion. Um, because your question is directly with COVID, because without COVID, we cannot do anything. It is COVID only. So, as a center, in our center, we are taking COVID for last 2 years. And the second wave, uh, till now, we have treated around 700 people in our center. So, looking at the role of physiotherapy here is very, very important, immense role actually. So, uh, it starts from, uh, building the respiratory reserve. That is the reserve of your chest, lung. Because the most dreaded problem with COVID is pneumonia. Pneumonia is your infection of the lung, and that's why the lung reserve is very, very crucial if you want to survive this disease. So, physiotherapy can build this lung reserve like anything with, with lots of breathing techniques, breathing exercises. People can build their lung reserve to that extent that it will help them while they have any COVID infection, because this is the lung reserve which will help you surviving a crisis period actually. So, uh, uh, yeah, already you mentioned that it's a multidisciplinary approach where everyone's contribution is immensely important, starting from your supporting staff like dietitian, like your housekeeping staff, other radiology lab is very important. And when patient is serious, the critical care specialists, they are very important. Pulmonologists and medicine specialists, they are all involved. Role of physiotherapy is immense. Actually, I don't have to elaborate much about in this topic, because see, entire medical science, everywhere physiotherapy is required. You name a disease, you any disease, you just name it, and there is a role of physiotherapy in it. So as a preventive or as a treatment option, physiotherapy has immensely helping the medical care. So this is the time where I should thank them for their immense contribution in the medical field. And one request to them also that they should also be, protected. So they should be safe. They should all be vaccinated, and they should know how to how to be protected by themselves, because all those protective PPE, protective equipment, protective gears, they should not do any compromise on that while treating a patient. And vaccination, I have already told that it's very important. So, because this workforce is so much important, so they should also protect themselves. This is my personal request to all. And I think we should continue. And I think I should stop here, and you should all continue the session. Thank you.
Thank you so much, sir. Indeed, it was a pleasure hearing from you, because you have aptly said that the physiotherapists should also take care of themselves as well. The entire medical fraternity should take care of themselves while treating these patients, because it's a very deadly virus. I have personally dealt with many of these patients, and believe me, sir, it is really a huge task on us to take care of these patients. But it gives a satisfaction when a patient comes out giving you a very positive feedback. And thank you all to you also for supporting us physiotherapists, and we are working hand in hand. And thank you so much, sir, for giving your precious time to us. Hope to meet you once again. Thank you, sir. Okay, so continuing with, we have Mr. Vijay Kumar MG, sir, who is having 27 years of experience in healthcare technology, including the telemedicine. He is also listed among the silver category blogger in top 50 members of ATA 2014. He is also a member of American Telemedicine Association from 2007 to 14. He is actively involved in COVID-19 telemedicine support system towards the world support system for World Malayali Council UK wing. He is also the executive member Telemedicine Society of India. He is also the honorary secretary TSI Kerala chapter. So I welcome you, sir. Thank you so much for giving your precious time to us. I'm glad. And definitely, we want to hear something from you about telemedicine, because this is the new norm. I can see this is the new norm in everyone's life, and everyone is busy doing all their transactions through telemedicine only, and being in a medical field, treating patients. And this has given us a new avenue, new opportunity to explore many things and to save many people life without all these traveling issues, cost issues. And you can also remotely and actively participate in saving many of these COVID patients. So over to you, sir. We want to hear many more new things from you. Over to you, sir.
Thank you. Thank you very much. And first of all, I'm honored to be here on the World Physiotherapy Day. And I thank you, both of you, for inviting me to this event. Let us talk about telemedicine and tele rehabilitation service to tele rehabilitation service. Okay, this is the time that the shift is happening, like rehabilitation to tele rehabilitation. I will try to share my presentation. Let me see. Okay. Can you see the slides? Hello?
No, sir, not yet.
Or maybe it is streaming. start?
It will be visible, sir. Yes, sir. Now it has started. Yeah, yeah. Yes, sir. It's coming.
Okay.
Yeah.
So it is from rehabilitation to tele-rehabilitation. Okay. So next, rehabilitation. I don't have to say anything because you are all physiotherapists. So the action of restoring someone to health or normal life through training and therapy after addiction or illness group. It is collected from Google. Okay. So you are all very much aware what is rehabilitation services. And telemedicine. When it comes to telemedicine, it's a term. We were in India. We started knowing this telemedicine since 2001. Okay, uh, it is. I'm started my telemedicine in 2002. So telemedicine is nothing but a communication platform connecting patient with healthcare provider, irrespective of the geographical area. So first of all, big thanks to ISRO because this terminology is made available in India by the Space Research Organization.
Sorry to
Space Research
interrupt you,
Organization.
sir.
Yeah.
Uh, Sir, are you? I mean, the slide is moving. It's not visible to us actually.
Okay, okay. So I'll just stop then. Okay, it is because hello, I
Yes,
stopped the
sir.
slide. Can you see me?
Yes, sir. Yes, sir. We can see you. Yeah.
Because maybe because of the internet speed, it is not moving. Okay,
No problem, sir. No problem. Yeah.
I just move the yeah. I'll just take. Okay, now uh, about telemedicine. I hope what I said mentioned is you heard right. Telemedicine about telemedicine. So now it's actually big thanks to ISRO. ISRO made all this possible in telemedicine because in India the telemedicine was initiated by the ISRO and they provided the satellite link, they provided the software, they provided the hardware, and around 60 specialty hospitals connected to 306 remote rural district medical college hospitals and 18 mobile telemedicine units are there in the market. Okay. So now see the corona made us sit at home and the physiotherapy um, practices are very much difficult to get by the patients at their home and what we have done is we started tele rehabilitation services. Okay, so what do you mean by tele rehabilitation services? See, using the facility of the video assisted, we supported the physiotherapy people to come online and to the patient to uh, give the instruct the patient or direct the patients for the rehabilitation services and even also we have done many programs in for students in a speech therapy and all online. So that are part of our tele rehabilitation services we have done actually. And that actually benefited a lot of I had a few videos also. I just wanted to show you. I don't know. I'll just try again because if you're able to see the video, just it will be a,
No problem, sir. You can try.
just see. Oh, it's on the other way, right? No. Hello, can you see the video?
No, sir. Actually, it's coming and getting back.
I don't know.
Now it's coming.
I don't know, some problem with the system. I think it is coming. Sorry, the orientation of the video has gone in wrong direction. Sorry, sir. Nothing
No
can
problem.
be
No
done.
problem, sir. It's okay. It's
At
okay, sir.
least you can see that we have conducted this. Okay. Okay. So tele rehabilitation. In fact, see from the patients, they cannot go to hospital. They are worried of going to hospitals, and they are in pain. So this is the tele rehabilitation is the only solution that they can be at home. And also the physiotherapist, they should not get infected because going to a patient home, maybe that's a positive case, so they should not get infected. And this is the option that you should adopt, and widely you should use it, because at least for many things the touch is healing touch from the doctor and the physiotherapist is required. But this time now, since the pandemic, we have to use all sort of these kind of technologies to assist you to provide the support to your patients. And also we have done so many awareness programs we have conducted. And the patients sitting at home, they will be having a lot of doubts that how the pain can be relieved and all. You can guide them online. And we used to conduct the video programs, video based programs, and they used to attend, and demos also, live demos. And also they used to teach materials from copyrighted materials. They teachers used to get it from the net, and they used to give trainings, so that patients get benefited. So this is a noble thing, and you can use the tele rehabilitation process into your daily life, so that the patient get benefited. So that's all I have to say. Anything questions or anything I can take?
My network was actually bad, so I just I missed the starting part. So you have any experience for COVID patient as well, the long-term COVID patient?
Uh,
The thing we
See,
have.
yeah, we have started with I'm basically from Kerala. We have started a service, COVID care free service by an NGO, and I was supporting that system. And we get a lot of these type of calls for long-term systems and symptoms and all. We get used to get calls, and doctors from even from abroad also were part of our network. They used to uh, give the care. And they in fact, we had got a connection with the UK based system, and we've got a very good trained nurses. They support actually this system. And we could provide a very good service to them. And I suggest you all to join our Telemedicine Society of India, and be a part of it. And start doing more tele-rehabilitation, tele-consultation process, so that your patients will benefit. Thank you very much.
So one more question is there.
Yeah.
You educate us about the telephysiotherapy and its uses in COVID patient, or recovery, long-term recovery or long-term COVID patient. What are the equipment we should use? The physiotherapist should use
See,
in terms of
in terms of telemedicine only I can say. Okay. So in terms of telemedicine, see, you best thing your mobile phone will do. Okay, most of the people they will have their mobile phones, and many of the schools they are using online education. So most of them will be having their smartphones, and smartphones these days, most of them can afford to go with the smartphones. So use that smartphones. You can get video conference, video consultations online. You can give directions when tele rehabilitation programs can be conducted online. So that is the basic requirement. Is a mobile will do the basic requirement, and otherwise, if you can see, internet is a big issue. So see the connectivity. Most of the places, even in the rural areas, connectivity is good actually nowadays. We can say most of them teachings and schooling, everything is happening online. So I think now we can start using with the mobile technology. So that's it.
Any new innovation about the equipment or about the telephysiotherapy? Physical, equipment. We integrate the equipment with the telemedicine technology. So, is there any innovation, any new equipment or machine is coming up in the market? Physiotherapy.
Um, Physiotherapy equipments are mainly, you can say, it's directly applied to the body and body parts. So um, we can a lot of AI based devices now it's coming up in the market that is augmented reality based. Okay, so that in fact it can be integrated with the telemedicine, and then the patient sitting at home they can do the augmented reality based exercises and all. So that is possible, but still I think not much innovations happened in India, and I think it will be coming in very short of time. It will be coming in India, so that this augmented reality based systems can be integrated with the telemedicine video conference, and that can actually give sitting at the patient home, patient can do the exercises using the augmented reality. So it can be controlled by the physiotherapist from anywhere in the world. That's Thank you.
And
That's a good
what
question.
one more thing? What about this is for the physiotherapists, the individual or freelance physiotherapist, then the institution. So how about the controlling system? How about the organization and administration can use the telemedicine? I think a
I am
noise is
sorry. There is a noise there. I could not fully understand the
so
question.
if you simply make us understand about the process flow or how the organization is going to use the telemedicine
Telemedicine.
services of
Telemedicine facility. Yes,
physiotherapy
yes.
and how
Yes,
the
yes.
physiotherapist can also use that process flow. Just an idea, so that physiotherapists can
Sure,
have an
sure,
idea,
sure,
and the
sure.
organization also how can they implement in their organization.
Sure. See, this can be you can have a tie-up with a telemedicine company, and then they give a see in our system it is like this. You have a appointment system there, scheduling system is there, and you can schedule the appointment of a physiotherapist online, and then on the and they can pay it online. Then on the time of the consultation appointment the physiotherapist comes online and the patient comes online. The physiotherapist can give the necessary support, and then you can advise can be send it over the uh, phone or email. That way it works. So main is the video conferencing, because video conferencing is an essential part of this service. You cannot talk to a patient and find out the issues. I think video conference plays a major role in that.
Sir, I also want to add one point, if you allow. I think it can reduce the work pressure also for the physiotherapists because they can control it from their home. If they have, hundreds of patients or more than hundreds, so, individually checking all the data, then giving advice and, fitness session is very, difficult. So, with the telemedicine, they can do all this from their convenient time and from their home, and they can also, save time, I think, that way. So it's a cost effective and, they can also save time, I think, with
I
the
agree with
technology.
you, Rooney, ma'am. I completely agree with you. And also to add on, sir, the patient is also able to modify his own way of managing, right? Supposedly we
Right.
are not there. As I had already, I am also into this telemedicine consultation since quite a long time. So from my personal experience, I would like to share that definitely it provides the second opinion as well to many of the patients. It helps them a lot. At least they find it easy that somebody is there 24/7, so that we can connect with them through telemedicine. It's not necessary to travel and to visit somebody during this pandemic time. And also it gives a control to the patient as well, that he knows that what to do with his body, right? That when he's taking the entire treatment protocol onto themselves, they know that this is the way that they want to sit, this is the way they want to move, or something like that. So this gives them then opportunity to experiment on themselves and to, yes, work towards their body on their own. Yes, sir. Yes, sir. And sir, one more thing I would like to ask, that do you think telemedicine should be added as a course in some of our syllabus in this medical
Yes, yes. That's a very good opinion that we should add that telemedicine in your practices. It should be there, and when you study, it should be one core subject also because this is the future. So must include that also in the course.
absolutely, absolutely, sir, because this is going to go far, far beyond the
Yes.
boundaries. And
And India, we are doing great actually because you must be knowing heard of e-Sanjeevani.
yes, yes, sir.
They
Heard
they
of it.
they are they have done more than 60 70 lakhs consultations, video consultation. They physiotherapy, they may not have a separate wing, but we can actually recommend that also. It's a free service, and I am into it actually. We are into tele rehabilitation services.
Right, right, sir. So, in Kerala, particularly in your place, sir, how it is moving forward with all those, as ma'am mentioned about the technologies, how we are going to implement them in some institutions, right? As we are individuals, we are consulting patients through telemedicine, right? So, what do you think? What are the major things that has to be taken into account when you start consulting through telemedicine, besides those internet connections and everything? Do you think there is an awareness that has to be created among others about telemedicine, and how they are going to advise their patients?
See, what happened is Corona, the telemedicine started years ago, but when it comes to the pandemic situation, only people started learning Corona and learning the telemedicine. Understand? So that time onwards, now people are first thinking about, instead of going to hospital, they are first thought to go with the telemedicine consultations, because if they go to hospital they get affected, that's an issue, major issue. If you go to a hospital sitting with a corona patient, there's a chance for getting infected. So this is the a lot of awareness needs to be created still. People will be, a lot of awareness programs needs to be conducted, so that people will come, they will be the this will be the first choice for the consultations later.
Absolutely, 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 sir. I agree with you, and thank you so much for your kind words. And you have provided us with this, explaining some things about this new norm that we are going through, and I think it's going to continue for a long now. So, thank you so much for all the informations that you have given us, sir. Thank you so much for your time, sir.
Thank you very
Thank
much.
you. So we have Dr. Pallavi Goswami, ma'am, who have just joined
Hello.
us.
Yeah.
Welcome, ma'am. She is the
Yes.
Principal of
Yes.
College of Physiotherapy and Medical Sciences, and she is the Center Advisor and Prototype Manager in DPRC Guwahati. She is also the State Coordinator for IAP Assam branch. And I think, ma'am, this is a golden opportunity for a junior like me to learn something more from you. And we all are waiting to listen from you regarding the use of physiotherapy for a long COVID cases and
Yes.
rehabilitation. So
Yes.
over to you, ma'am.
Yeah. Yes. Yes. I am really thankful that you gave me this opportunity to be associated with you today. I'm little late actually. I'm working in a college, so we had some celebrations there. So I had to complete that, and I came back home. Now I'm being live with you from home. So yes, now the situation, like since last year, the situation has become very crucial for all of us. Although we are now living with the situation, that is the COVID-19, but still, every day we are going out and we are exposing ourselves to that situation. So we are always prone for that, isn't it? Although we are taking vaccinations, and people, after getting two vaccinations, also people are getting the COVID-19. So now, being a physiotherapist, first of all, I would like to wish everybody a very happy World Physiotherapy Day today. So, being a physiotherapist, what I feel is the situation of COVID-19, being in a hospitalization or being in a home, but this post-COVID situation is much more dangerous for the patients, because we are seeing the patients that initially they are having very mild kind of a symptom, but gradually later, once they are, even after they are getting negative, their weakness, their overall health condition deteriorates. So that part, which is this year's even the World Physiotherapy Day theme, is the long COVID and its rehabilitation, which means that the person, once they are getting negative, also then also they are facing so many issues. Even in my family, there are so many people who got affected, and the same complication or same complaint what they are giving is, we are always tired, we are always very tired, we cannot do the things properly. If we get up from sitting, or if we are simply going for a round inside the house, we are getting breathless. And so these things are actually hampering the people in day to day life. So what I feel is, the post COVID situation is, there the physiotherapist has to have a very important role, where the main thing of this field of physiotherapy, or the physiotherapist has, is the or the breathing part of the patient. I think the overall lung capacity, overall lung issues are getting down, or it is getting deteriorated along with the COVID. Definitely, everybody knows the impact of COVID on the lung tissues. So I think that the physiotherapist always has to work more on this lung field, and this lung issues has to be tackled first. Along with that, I think the home stay or the hospital stay of 14 days, or maybe someone are getting negative positive again and again after 2 3 times they are, if they're even the checking, they are getting positive. So maybe the hospital stay or the home stay is getting lengthened. So I think Dr. Shakti known that, well, you very well know that once we are getting confined to a room or a bed, our automatically muscle atrophy starts when we less using the muscles, isn't it? So this is one thing again which is making your body, you can say, more vulnerable to weakness, to falls, to have a more uses of the muscles, which is again indirectly hampering the lung fields. So, along with the breathing, of improving the breathing of the patients, we also have to work more on the mobility of the patient. And I think we also have to work on gradually the strengthening of the peripheral muscles, which is again very important, which is indirectly or directly is going to, you can say, empower your lungs in long run. So I feel, so this is the protocol every physiotherapist should take whether they are working in a hospital or whether they are seeing the patients post-COVID in home. Because recently I have come across 2, 3 cases where, uh, despite of they become negative and even their lung fields are better now, but they are now having other issues like knee issues, hip issues, back issues after staying in home for a long time. So this is something we have to again see along with the breathing part. And I'm a little concerned about the geriatric cases in this pandemic because they are more prone for all this, you can say, orthopedical conditions. And because of this thing, they are unable to reach to a hospital or to a physiotherapist directly. So just now you had a session of telehealth, which is very important for them, because recently I got 2 or 3 cases recently, like they had a tele consultation with me because of their one is 65 or 70 years old lady, one is 68 years old male. They are now facing issues in other fields. So along with they were corona positive, then they become negative, but other physical issues are coming into play more than the breathing issues now. So along with that part, we also have to look into the other part, because overall we are going to treat the patient, isn't it? So I feel we have to give more emphasis in all the other areas. Being a physiotherapist, overall well-being is our motto in this time of pandemic, I think. So this is my few words today. So that's what. So anything else, if
Thank you.
you really
Thank
want to ask, you can.
Absolutely. I have a lot of questions in my mind, so definitely I will be
Yeah.
asking. Um,
Yes.
I want you to, ma'am, just let us know or highlight about some of the techniques that are followed in hospitals and those techniques that can be followed by a patient at home if he is home quarantine, right? Like as we
Mm,
mentioned about telemedicines and everything. So there should be some kind of guidelines that should be followed by a patient, as I have also seen many patients that they want to do
mm,
these things during a particular time of their day, right? They want to
mm,
know what are the things that they should follow when they are home
mm,
quarantine, and what are the things that are actually followed in the hospital based when they are during the COVID stay in the hospital. So some points on it.
mm. Yes. First of all, I would like to say the home quarantine part, because until and unless the patient is very ill, we don't usually send them to the hospital. We usually tell them that you be in the home for 40 days and have a home quarantine. So yes, in that situation, it is little difficult because they are confined to a room, they are confined to a certain place. So in that case, I would like to advise that although they are being confined in the room, so initial part when they are very ill or very sick, uh, they need to take rest. That I can understand. But along with that, if a person is mildly affected, I would like to say that regular breathing exercise, at least daily, twice or thrice, if possible, breathing exercises will be very, very beneficial, especially the deep breathing exercises where we are mainly making our lung fields to expand so that more of the oxygenated oxygen is going to the blood, and it is going to help the lung tissues to become more active. Okay. Along with that, it will also help the secretions to move out of the lungs if there is any secretions. Along with that, we can advise them to do certain bed mobility exercises, which will be very, very beneficial again, because they are unable to go out, they are unable to walk around, because maybe some people, if you see that someone is having a regular you can say habit of having a walk every day, but once they are having a COVID positive, they are being confined to a room. So in those cases, we can tell the patient to go for the bed mobility exercises, all the isometrics for all the muscles. Along with that, we can definitely go for the gravity, you can say against gravity muscle strengthening exercises will be very, very beneficial. Again, we can go for the different back exercises, extension exercises. Again, we can go for simple, you can say, marching in one place, which will again help the muscles to be active for a longer time period. Along with that, the lung will also be active along with the muscles in the within a room kind of a exercise. Definitely, nowadays we can also advise them to go for a theremin exercise, the mild ones. It will be very, very beneficial to at least maintain the muscle strength, so that once they are coming out of the room, out of the COVID quarantine time, they will be at least active. or their muscles are not going for much of the weakness. So all these things will indirectly help the lung also, what I feel. In the hospital stay, that actually on depends on the phase of the patient through which they are going on. Like if in a very critical stage, if the patient is under ventilators, or if the patient is under constant monitoring in ICUs, then again in those cases the main chest activities or chest exercises can be given, that too with a very expert hand, so that we can mobilize some of the secretions, or we can clear the lung fills in that. Along with that, we can also go for the very mild bed mobility, so that if a person needs to be there in the hospital for a very long time, then they should not develop any other adverse effect of the bed, confined to bed. So this thing should be, you can say, tackled by the physiotherapist. And once their condition improves little bit, then we can definitely start with the mild mobility exercises within the space of the hospital. So what I feel is, along with the COVID-19, regular body movements in whatever possible way is very, very important to directly or indirectly help the patient to cope up with the lung fields, and also with the muscle involvement. So this thing I think should be beneficial for the patients. Yes.
Right, ma'am. Absolutely correct with that. So, another one thing I would like to ask: many people are very much confused regarding if after the post recovery phase, when they are supposed to start with their workout regimen. Many of them have asked me this
Hmm.
question: what is the right time to start? Because usually after a patient has been, affected by COVID, they usually become very weak. Weakness
Hmm.
persists
Hmm.
for a long time. I think you will agree with
Hmm.
me.
Hmm.
So, what should be
Yes,
the
yes.
ideal time after the recovery from the COVID-19, that they should, okay, this is the time that they should start working or walking, or starting up with some non-weight bearing, then partial weight bearing, then full weight bearing
Hmm.
exercises.
Hmm. Hmm.
If somebody is, as you said, is used to go to gym or workout, they are
Yes,
very,
yes. Hmm.
curious to know that I should be going back to my routine regimen, everything.
Hmm.
So,
Hmm.
can you
Hmm.
just highlight about these things, that what should be the ideal time to start, and how they should start in a very phasic manner?
Yes, yes. See, Dr. Shakti, we cannot exactly tell a time period that this is the exact time, because see, uh, every patient has different kind of affected lung field, isn't it? Some are being very mild, some are having a very in a medium way, or some are having a very high affection. So in those cases, what I feel is, once they are able to do the minimum breath holds or breathing exercises, and if they find that the roaming around, or at least going inside the house, or they have to start with that first. Okay, just simply going around the house or walking around the campus, is it making them breathless? What is the time period for them that it is making them breathless? So they have to monitor that first. So if they find that it is okay, then they can gradually increase the timing of the walking. Or simply, the first thing what I advise for every patient is to just simple breath exercises, like
I think there is some connectivity issue with ma'am now.
improve your condition.
Hello, Pallavi ma'am, you're not visible actually. Your video is not moving.
Yes, there is some network connection happen.
Yeah, it's
Just a
okay now.
second.
Yeah, it's okay
Yeah.
now.
Just a second.
One thing I would like to add is, see, these network issues that can also affect our tele-rehabilitation process.
Right, sir.
So we must actually consider this also, anticipate this kind of issues while doing tele-rehabilitation. It can happen anywhere, anytime. So this also to be taken care while doing a tele-rehabilitation process.
Right, sir. Right, sir. This is completely, I mean, very involuntary process that it might happen anytime during your
Yeah,
consultation period. So definitely, uh, I think we'll wait for 1 to 2 minutes more to Palima ma'am to join.
yeah, we'll wait.
Yeah.
Achha, so I was saying about that. So I want to tell the how a person can start the exercise. It should be from a very mild exercise program. So which usually includes a very mild walking they can include, or inside their confined spaces, or inside their home, inside their campus. Along with that, breathing exercises should be continued initially, and the exercises I think they should start with active assisted, or you can say against gravity, because gravity is the first resistance what we can apply on the patients. Gradually, when they are finding it comfortable, okay, that will again depend on the age, sex of the patient, or you can say the amount of COVID they got, or how the body was affected. So we cannot generalize it, but yes, they can start in that way. And I think in home only they can start with the very mild weight once they are finding comfortable with the other exercises. Then after that, if they find it comfortable, then only going to the gym. But I think hitting a gym will take some time, because in gym you need a very good you can say you need a very good lung power. So for that, I think the people needs to first you can say habituate themselves in the milder form of exercises, and especially the breathing exercises. I think 1.5 months or 2 months after the COVID, or maybe 3 months, someone may take for a long time. So they can hit the gym definitely. But otherwise, I advise everyone to go for a milder form of exercises from the time they can tolerate the exercise regime. So this thing will be very, very beneficial. Otherwise, the thing will take time to recover. Exercise will be the only thing which will help them to recover as soon as possible.
Yes, ma'am. That's really correct, because we don't know, because every individual is different and every individual's body will
Yes,
react differently to the virus. We don't know when is the correct time for the patient to recover, right? So they have to act
yes, yes.
accordingly.
They have to monitor themselves first. How
Right,
much
right.
breathless they are after walking for how much? Because here again we introduce as a physio, there are certain tests we have, like 3 minute walk test, 5 6 minute walk test. So those things can be implemented. We can tell the patient that you can go for a 3 minute walk, and you can see like in how much time you can cover the 3 minutes. So that will say them that how much better their lung fields are going to be, or how they are recovering. So that thing will help. Initially, they can go for 3 minute walk test, then they can go for 6 minute walk test. So this thing will help them to have a biofeedback. You can even say, you can say they can have a they can have a thought for themselves that okay, fine, I'm able to do now 3 minute walk, so I can go for a more of the walking. So like that, they have to increase very gradually, and we cannot generalize the time. As I told you, it's difficult. Age is a matter, again the gender is a matter, body build is a matter, immunity system is a matter. So there's so many other factors which is going to be there. So but yes, minimum thing we can advise to the patient in this way.
Okay, okay, ma'am. So I have another question for you. As we are janitary are more focused towards women or our mothers. So what can you say
Yes.
about if a pregnant woman is affected by COVID
Hmm.
19? How she is going to deal with it, or what are the things they should, you know, whether it's
uh,
mild, she's at home. Yeah.
Because see, pregnancy is still a question at present, what I feel. Because pregnancy, they were saying that you cannot be vaccinated initially. But now some of the things are coming up, like yes, pregnant women can be vaccinated. So in pregnancy, it is definitely very difficult to deal with the COVID case, because uh, like in some of the patients, they have a very severe cough along with the COVID. So this is again going to hamper in the fetus. And along with that, they have already they are suffering with so many different pains and changing in the body. So already they are having the mothers are being tired very easily because of the growing fetus, or you can say the different changes in the body. So in those cases, I must say that the protocols we can follow, whatever we are following for the other patients, but yes, we need to give more support to the patient, as they are in a little different phase of life now. So this COVID thing, because to say frankly, directly, I'm not dealing with any COVID pregnancy cases, but how much studies I came to know about these, and like theoretically how much I can say is that exercises for each phase of the trimesters, first, second, third trimesters, should be given to them. Along with that, I think the immunity part, we should tell the patient, we should advise the patient, or not the patient, the lady, to make their immunity strong. So that that is the only thing I think we can advise. And along with that, other protocols, what we are giving to the other patients can be given in a milder form to the mothers. That will be beneficial. The exercises, yes.
Okay, okay, ma'am. So, as we all are very much aware that now the very current thing which is streaming now is we are going to have a third wave in COVID. The third wave COVID
Hmm.
is coming and something. So, do you think actually how we are supposed to calm down people? Say that it's not a thing to panic. It's a very normal thing that people
Yes.
are getting panic, they're not getting out of their house, and obviously they have to follow some very the sanitization part and everything, they have to take care of it. But as
Hmm.
physiotherapists, what we should follow, I mean what we should be ready with, so that we can tackle this situation, or we can tackle with the patient who will for God forbid we should not have such kind of third wave in future. But what are the
Yes.
things or techniques that we as physiotherapists should be ready with?
Yes, Dr. Shakti. I think the precautionary part will play a role in this phase, the third wave, because third wave is said that it is coming on its way, and moreover, everybody is saying that the children will be more affected. It is saying like that, but there is no as such till now the written thing like that this will happen exactly. So we have to be prepared for that. So what I feel is like here everyone has to have a precautionary phase for each of you, like how we are preparing for it, whether we are improving in our immunity system, whether we are, first of all, though I would like to advise everyone to have a proper precaution of wearing mask, where the normal things what it has been told since last year. So I think awareness programs should be more, although everywhere it is given, but people still are not following some of them. So that is the first thing we have to go for it. And secondly, the to prepare the body for hitting this third wave is the regular exercise regime. What I say, everyone has to go for, because until and unless we make our lung fields very strong, we cannot deal with the COVID-19, because a weak lung will get the infection very easily. So I would like to advise everyone for this coming time of third wave to have a very good you can say a strong lung. Along with the exercises, different breathing exercises can be advised. Person should come to a physio, or they can have a physio consultation, they can go for a teleconsultation, no problem. So if they don't know, they have to learn the different exercises, breathing exercises, which can help them to prepare their lung for this third wave. Along with that, the regular exercises, minimum exercise should be done by each and every person. It's not like that it is only should be done by a certain group of people, but I think it should be done by every people in the society, because that is the only way how we can tackle it. And moreover, being a physio, definitely we have to be always ready to because we never know what kind of cases we may get in coming time, because every time again the symptoms are changing, isn't it? There is some mutations in the gene, very very easily it is happening. So we also have to be equipped with that. Every hospital should be equipped. Again, the every hospital has increased their COVID beds. I think in between it got reduced. Again, they are increasing because of this third wave, which is coming into play. So I think physios also has to be equipped with your techniques and advices for the patient, and the society should help themselves with the different exercises, different even the nutritional part. The immunity should be proper so that we can have a proper fight with this COVID-19 in the third wave. Yeah.
Thank you, ma'am. This was really, really an eye-opening for all of us and for all the viewers who are watching us also, because we have
Thank
given
you. Thank
a
you.
beautiful insight into this world of physiotherapy, where we can say that we are adverse. We are moving forward with many such techniques like telemedicines, and we are also working, as
Yes.
I have already mentioned, a multidisciplinary team along with our fellow
Yes.
medical
Yes. Very
professionals.
important.
Very
Yes.
important. So
Yes.
we
Uh-huh.
also, yeah, we also need to understand, the role of counseling, educating, advising the patient regarding what to do and what
Hmm.
not to do, what are the precautionary measures, as you mentioned, should be taken. that
Yes.
that these should be some highlighting points, and we should take care of it. And the patients should also give an importance to their own health. They should come forward, consult physiotherapist,
Yes.
even not in person, through teleconsultations or whatever is
Hmm.
available at their doorstep, and they should keep themselves fit enough so
Yes.
that they can
Yes.
fight the coming viruses, or as you say, the new variants which are coming. So thank
Exactly.
you so
Exactly.
much, ma'am. Yeah, it was wonderful
Thank
listening
you.
to you. Yeah, it was wonderful listening to you. So we'll move
Thank you. Thank you
forward.
so much for giving me this opportunity to talk a few words. Maybe at least it is if one or two person will be listening to me, or if they follow me, I'll be blessed. So thank you so much for adding me today in this beautiful, you can say, talk. Thank you.
Yes, ma'am, absolutely. I think whoever is watching, I mean, at least we can help those people, whoever is listening to us, they will be glad to take all these advices from you all panelists, and they can at least implement
Yes.
those things in their daily activities, because many people are fighting with this new kind of
Yes.
thing, which is,
Yes,
revolving around the world.
everybody needs to be you can say cautious about their own health, because until and unless we don't monitor ourselves, no one is going to help us. So
Absolutely.
the right time, the right treatment, the right place is very important, and to have and to, you can say, prepare the body. It's
Yes.
not like that ki I did not get COVID last year or this year, I may not get or I will not get. This is
Right.
not something that anyone should think. So it is a
Hmm.
disease, any it can reach to any person anytime. So we have to be prepared for that. So that is my advice, that everyone please monitor your health, monitor your body, take the treatment as soon as possible, and that will help us to fight this third wave.
Yes, ma'am, absolutely. Thank you so much for all your wonderful
Thank you
words
so
today.
Hello,
much.
Pallavi.
Thank you, ma'am.
Yes, yes.
Pallavi, can you just highlight on the tips for children as well for
Yes,
post-COVID
ma'am.
or
Your
pre-COVID
voice is
recovery?
breaking. Your voice is breaking, ma'am. Hello.
Am I audible? Am I audible?
Yeah, yeah. I mean, your voice is
Am I
breaking,
audible?
so I'm unable to. Yeah, yes, yes. Tell me. Yes,
I think the network issue.
yes, yes. I think there's a
Any
network
tips
issue.
for children? Any tips
Okay.
for children
Yes. For
for post-COVID recovery?
Yes, yes. Children, like they are definitely more prone than the adults, and the if the immunity part is lower in them, and they are more prone to get the condition. So I think we also have to take a more precautionary point for the children, the normal the things what we are following, like to have a non-contact or to have a more precaution for them. But along with that, we have to have, you can say, the breathing part. Again, it's very important for them because the COVID is ultimately hitting each one in the same way. So if it is an adult or a child, ultimately your lung field is getting affected. So for that, as children, they are more active than the adult. So we can make them do the activities or do the playful activities in their way. So that will help them to cope up with this you can say strengthening of the lung fields, which will help in the long run for the child. And moreover, compared to adults, children are lesser affected as they have a this lack of receptor which is going to carry the carry the COVID-19 to the body. So they are less prone, but still, as if the child is affected or if the child is getting the COVID-19, then we have to have a, you can say, uh, proper breathing exercises and all the other activities which we can give for adults, we can also give for the children. But it should be in their own way. It should be in a playful activities, or continuous monitoring is again very important by the parents. So that I can say about the children at present. Yes.
Okay. Thank you so much for your time.
Thank you. Thank you. Thank you.
Thank you so much.
Okay.
Okay, so moving forward, we had, yeah. Yes, Rumima.
Shakti, if you don't mind, Pallavi or you, from anyone, if you can highlight on the COVID toolkits for the long-term COVID management, the physiotherapy toolkit for the long-term COVID management.
Physiotherapy toolkit.
Yeah.
Yes, ma'am. Toolkit.
Or the protocol the physiotherapist should maintain.
Yes, yes,
For
yes.
a long-term
What
COVID
we
management.
yes, for long COVID, no? Okay, if I say about the toolkit part, like what we can keep with us or what we can practice being a physio, first of all, I would like to advise every person. I think this is known by everybody to have a oximeter with you to check your continuous oxygen level, which is usually this thing I want to mention here, because our oxygenation level, it should not go down 94. Okay, 94, it should, beyond that it should not go till 94. Till 95 we consider it as very normal, but below 95, if it is going down till 94, still we can say that it is okay, but beyond that, beyond 94, it is a medical emergency. So person should keep a oximeter along with them all the time. Along with that, we can go for this the other breathing devices. It is not clicking me
Spirometer,
right
ma'am.
now at present.
Spirometer.
Spirometer. Yes, spirometer. Yes. Even I have that in my home. I'm giving to my mother-in-law to
Even
at
I
least
was
practice it,
having that.
although she did not catch. Yes. The
Yes, ma'am.
spirometer can be given. Yes. So the spirometers can be there along with every person in home, which will help them to monitor like how much their lung fields are getting, or how much the strength they are getting in the lung fields. So this will again help. Along with that, I told like two different tests which should be known by every person. That is 3-minute walk test and 6-minute walk test. This is something, a very basic equipment, you can say, or a tool which should be known by every person to monitor again the breathlessness and the respiratory field. So these things can be there, should be there in home, and this thing will help to have a monitor on your health. So from the toolkit side, this is the minimum thing a person can keep in home. Regular monitoring, yes.
For physiotherapy or physio rehab for COVID patient, any special equipment you have?
Ma'am, your voice is
For
breaking. I'm
yes,
not
for
getting.
physiotherapy. Am I audible?
Any? Your voice is breaking, ma'am.
Physiotherapist
Dr.
toolkit.
Dr. Shakti, can you just forward the
Uh,
question?
Ma'am, any special thing that should be kept for the physiotherapist? I think
Any equipments, I think she was asking
any
about any
equipment.
Oh,
type of
any
physiotherapy
equipment?
equipments.
Yes, yes,
Yes.
yes.
For COVID
Physiotherapy equipments
management.
in home
For COVID
or
management.
post-COVID management. Yes, yes. There is no as such specific physiotherapy equipment, but yes, I have mentioned about few things. For example, we can keep the therabins as the resistive for the resistive exercises. We can keep all. Just now I told about the spirometers that can be kept along with the patient, and the oximeter can be kept. Along with that, we can go for very mild weight cuffs, or you can say the balance boards can be kept along with them in home, which will again help to uh, uh, which will again help them to monitor the balance part, or you can say uh, just a second, my current has gone. Yeah. So so this thing can be kept, yes, minimum thing which can be kept in home. Main thing is like for the breathing part, we mainly need that only, spirometer and this you can say oximeter. So this thing will help. Otherwise, simple the weight cuffs, therabins can be given, can be kept with them. I think that much is enough for the time being. Later on, if we need, then we can provide them some other equipments for the further part. Yes.
Protocols. Any specific protocols that physiotherapists should maintain for post-COVID recovery for 12 weeks minimum for a long COVID management?
Protocols. Protocol wise, I have mentioned it already. It's the breathing part, breathing exercises, the different breathing exercises from very milder form. We can go for the higher ones. So these breathing protocols can be followed by the patient. Along with that, I told like it's the bed mobility exercises can be started as we are going for a very mild exercise regimes. Then gradually we can go for the balancing exercises, simple standing balance exercises. Then you can say mobility exercises in one place. Then we can go for the walking part. Gradually we can increase the timing of the walking. So these kind of things can be continued to cope up with the post-COVID situation, to cope up by the body. It's like once we are doing the exercises, we are helping our lungs or our body to cope up with the situation. So like that, we can continue with the exercise regimes. The minimum to the moderate and then to the tough ones. Yes.
Okay, thank you, ma'am. Thank you. Anything else to add, Rumi, ma'am?
Thank you.
You want to ask?
That's fine.
Thank
Okay,
you.
okay. Thank
Thank
you,
you so
ma'am. Thank
much.
you so much. Yes, thank
Yeah.
you, ma'am, for your
Nice to
kind
be
words.
here.
Thank
Okay.
you.
Bye.
Bye.
Yeah.
Okay. So moving forward, we have now Mrs. Rumi Bora, ma'am. She is a social entrepreneur. She is also the founder of two startups of India, that is Health DNA and Mint Lime, and under which the Janitri project, with the help of which we are organizing this event. And she is also the management professional, having over 20 years of experience. So as many must not have known about the fact that she was having COVID positive. I mean, she was suffering from COVID since few days back, and I had just asked ma'am to just let her tell her some of her experience, how she was feeling when she had suffered COVID-19. What were the hindrances, what were the problems or complications she was having in functioning the daily activities, how she was coping up with it, and what were her the ways she was dealing with the post recovery phase. So over to you, ma'am. Can you let us know something about your experience being a COVID patient, and how do you know about if you got any help, from the medical side, any physiotherapy techniques you followed, or any breathing exercises, or what are the things you were able to take along during the recovery phase?
Thank you, Shakti. So it was Shakti's idea to celebrate this World Physiotherapy Day, and this is always good to celebrate the physiotherapy. So I'm really thankful for all the panelists for their time and share the insight with us. Am I audible? I think my network connection is. Am I audible, Pallavi?
Yes, you're audible, ma'am, but there's some
Am
gap between your words. Breaking. It's breaking.
Sorry.
It's breaking a little bit, ma'am.
Yeah, there's a huge network issue in my area today. So, anyways, I'm still not recovered. Actually, it's more than 1 month because I'm COVID positive. So I told like it is always better to be in touch with the physiotherapist expert because post-recovery phase is very crucial, and it also affect the productivity also because I'm not able to work from last 1 month. So same thing is happening for most of the people, I think. So I'm not from the physiotherapy and healthcare background, so this is not my topic. But I want to highlight on one point, that is the productivity. So I just prepared one slide. So let me share with you. Can you see my slide,
Actually,
Shakti?
it's blank now. Yes, ma'am. It came now. It came now.
It is come.
Yes,
It
ma'am.
is the COVID-19 and the productivity.
Yeah.
So if we see this COVID-19 is still not over, so it is continuing. We have this much of confirmed cases, recovery rate and death tolls are going on. So if we see this issue on this topic, the physiotherapy, this is the most promising and futuristic branch actually. So we should more nurture this branch. So if we see the national crisis and productivity issue because of this COVID-19, we can see some points are there like COVID-19 infection, then remote working, mental health issues is there, then other issues is always there. Because of COVID-19, we have the illness, so during this COVID, deaths are there. Then when we affected by COVID-19 virus, we are not able to work. And if the recovery phase continues, then it also hamper the productivity. So we should invest how we should shorter the recovery phase. So that way, I think physiotherapy can be a very good use. We should prepare our body, like the Pallavi said, before the COVID-19, or we can get infected at any point of time, not for one time. I have seen the people who are infected for second time, then third time. So for any case, we should prepare ourselves. So we should, keep this fitness routine, or we should be in touch with the fitness expert or physiotherapist or COVID-19 infection, so that we can prepare ourselves, our body, and if we get infected, we can reduce the recovery phase so that we can come back to the work and we can increase the productivity or the working hour. Then remote working, so there are a lot of disadvantages also there in remote working. They know body and how to sit and how to work from home and all. So for that also we should take the advice from physiotherapist or fitness expert. Mental health issue is there. Like I think most of the population. I think 60 or 70% population are suffering from any kind of mental issues because everyone is working from home. They cannot go out. So this physical health also affect the mental health. So if we can keep ourselves fit, So we can also keep ourselves, healthy mentally. So that way also it can be useful. Then other issues are there, employment, hunger and other thing. So if we reduce that part, I think we should focus on mainly the fitness and come out from this issue, and we can focus on the productivity. Second, if we see this issue, as I mentioned, we can see the solution part. This is also my personal experience also, because I'm just going through the post-COVID period. So most of the thing we are there in this weakness phase. I had this mild COVID infection, but I had very severe weakness. So most of the part, I think the weakness we have to tackle. And COVID infection is there, food and medicine part is there, and mental health. These things are there. Here, the physiotherapy or the fitness can play a huge role, I think, in the solution of this. So we can invest in the productivity. This is all about my part. So happy World Physiotherapy Day. So we are organizing the session from Janitri, the community of love at the heart of reality. And this is a non-profit organization, and from our Janitri family, advice for all how to just a simple advice for COVID care. So if you get infected, then you take the advice for healthcare worker: proper food and rest. You should take physical well. You should maintain your physical well-being, then the mental well-being also. We are a non-profit organization. We are working for mother and child. We are mainly working on this three parameter: education, healthcare, and women empowerment. So this is all about today's session. So thank you for being with us, and thank you everyone for giving us your precious time and share your insight. Thank you so much.
Thank you, ma'am. It was really nice listening to some of your experiences that you have had during your COVID times, and definitely, I think that you have gathered a lot of knowledge regarding the do's and don'ts. What are the things that has to be followed, and everything. That was really nice. That was really nice of you getting information about physiotherapy, the entire thing. Because the person who has gone through this phase can only tell us what they feel, what they have experienced, and definitely whatever you have shown us and shared with us, it was really nice on your part. And thank you so much for organizing this event. So organizing this event on the World Physiotherapy Day. So coming to myself right now, so I am Dr. Shakti. I'm having more than 6 years of experience in clinical and academics. I'm working as an online consultant and lecturer. I'm also having my own clinical clinic at my residence, that is Move On Physiotherapy Center. So I would like to also highlight some very important things that I was also a victim of COVID. I think 2 to 3 months back. So it was really a dreadful experience, and God forbid nobody should suffer from these things. But if somebody goes through all these things, they should keep in mind all those things what our panelists have advised us: taking care of yourself, taking care of your health, your mental, your physical well-being, consulting a consultant or a specialist through telemedicine, which is a new way of dealing with your own body. And everything whatever you come across to you, everything whatever keeps you fit and healthy, you should all follow that. You should all follow the things which had supposed to be implemented in your daily activities. And physiotherapy, as I mentioned, is going to play an enormous role in bringing you out from that situation and will be able to make you move forward, having leading a very healthy life. Even I've also prepared some videos or pictures from my own clinical practice. I would like to share with you all. Okay, so am I visible? Rumi ma'am, Vijay sir, can anyone let me know?
Yes,
You are
yes.
visible.
I mean, just
Yeah. So video is coming, I think. Yeah.
Acha.
PowerPoint I can see.
Okay, sir. Okay. So this is, I have also gathered some informations regarding the things which are supposed to, are the physiotherapists are supposed to take in account, and what are the important things that
should
they
we,
should,
should we present it, no? Present it. It would be, more visible.
yeah. Okay, is it visible now? Nice. Rumi ma'am, am I visible? Is it okay from from my side?
You are visible. Your slides is still not in the presentation mode.
I have already done it, sir.
But it does not come in here actually.
Is it okay now?
No, doctor. It is still, we can see the, not in the presentation mode, but we can see the slide, the first slide and all the slides on the left hand side. Still not enlarged.
Is it
Did
coming
you
now?
try this? Did you try the selecting the specific window, or you can try selecting the entire screen? You just try that. We can see it is moving. We can see. Yeah, we can see it is moving. Yeah.
The complete picture is coming, sir, or the left side pictures are
Yes.
also coming?
Left side pictures are also coming. What you can do is you can try selecting entire screen. There is an option to select entire screen. You can close the presentation and sharing option you can close, and then if you start with selecting entire screen it may work. Now it is closed. Now you start
Okay.
sharing, and then you will have an option to select the entire screen. Please try that.
Entire screen. Yes, sir. Yes, sir.
Yeah, you select that just to try. I don't know whether it works, but let's have a try.
Mm,
Okay, now can you open the PowerPoint and enlarge it?
okay, so am I visible now?
Yeah, perfect.
Perfect. Okay.
Perfect.
Okay. So now we will. I will come to the role of physiotherapy in case of pandemic situations, that is COVID-19. Physiotherapists have played the role of a frontline warrior in dealing with the COVID-19 cases with application of various interventions like chest physiotherapy, cardiopulmonary assessment, pre and post COVID symptoms, prevention by rehabilitation, educating and counseling, that is the safety measures and all the other factors that were advised to the patients, and the teleconsultation for quarantine patients. So, as I mentioned, chest physiotherapy, there are a lot of maneuvers that we implement on our patients, and one of those things is the postural drainage. These are some of the positions that are implemented. Implemented by the patient, that can be done during the hospital stay, or if they are at their home. Okay, so if they are in the hospital stay, as many of our panels have, but they have highlighted that this virus affects our lungs. the lungs are coming into action during this time, and they are being mostly affected. So there are various parts of our lungs, right? So these various parts of our lungs can be affected in an individual patient, right? It can be an upper lobe, the middle lobe, the lower lobe, etc. Okay. So the various lungs, part of the lungs which are getting affected, according to the positioning or according to the areas of the lungs which are getting affected, the patient can be positioned in such a way that the secretions, the sputums, then everything which has got into their particular areas of their lungs can be removed out, which is known as the postural drainage. And it can be drained out. The position in which the patients are placed, that helps in draining out all the secretions from their lungs. So these are some of the pictures that I would like to share. Where are the right posterior segment, left posterior segment? These are some of the areas of the lungs which get affected, and the patient can be placed in these directions so that the secretions are drained out from their lungs. This is one of pictures from my own patient who was diagnosed with COVID-19, and he was advised for physiotherapy. We did a teleconsultation with him, and I advised him to take these positions and lie down, simply lie down by applying pillows under his hip joint, his knee joint, and we have seen a tremendous improvement in his health after I think around some weeks. We have taken those consultations. We were continuously in touch with the patient, and through that consultation, only teleconsultation, we had advised the patient to go for this positioning at home. He was not hospitalized. He was having some symptoms which were corrected at home only. So these are the actual pictures from a patient that I had treated. Next, we will go to the different kind of maneuvers which are followed in case of hospital and home-based physiotherapy interventions which are followed for COVID patients. As I mentioned, the spirometer. This is a kind of a machine or a technique which as Pallavi ma'am mentioned, that we should have it at home. These are also followed in case of hospital-based, when the patient is admitted in the hospital, to improve the lung capacity, to improve the endurance of the lungs. We use this technique where they inhale and exhale. They try to pull up the balls which are present. I think everyone can look into that picture and see that 3 balls are present. There is some measurement which is mentioned, and the patient is putting the mouthpiece inside the mouth and letting know that they are inhaling and exhaling, and they are able to move the balls up and down. This is the way they can improve the lung capacity and the endurance. Next, this is a home-based exercise that I advised to one of my patient who was not having any kind of maneuvers, so that he can do the physiotherapeutic breathing exercises. So I had mentioned to take some polythenes, or to do these kind of exercises where they can blow air inside the polythene, and they can blow up the polythene. This is also a technique where they can use those simple objects which are present at home, and they can do these exercises to improve the lung capacity. Next, we can see in the picture that how the physiotherapist and the other medical professionals can help improve the condition of a COVID patient by doing all those active exercises, movement of the hands, the shoulders, mobility exercises, mobilizing the chest, the upper back, lower back, and every part of your body which gets affected by COVID-19. These are the techniques, or these are the ways through which the physiotherapists deal with the patients at the hospital level. Next is another kind of a home-based exercise. As I have mentioned earlier in the previous picture, we can blow air inside the any polythene or balloon. Next, we can also go for some blowing activities at home, like blowing of a candle. They can do these activities while doing inhaling, exhaling through their mouth, and they can perform these exercises at home in a very simple manner. If they don't have much things with them, how can they deal with it? They can use these simple objects which are present at home, and they can do the exercises. So this is one video I would like to share with every one of you. It is a exercise which was performed by the patient who was not having a spirometer at home, and I just simply told that use all these simple objects which are present at your home, the straws, the balls, and the plate, and try to move the ball with the blowing through the straws. that also helps in improving the lung capacity in the recovery phase, in the post covid recovery phase. They can perform these exercises. These are very simple things, because we need to make the patient very comfortable at home as well. By using these simple objects, we can make them feel that they can also do the exercises, and they can also improve upon their condition. Ne- next we will move to the teleconsultation. As we know, this teleconsultation medium is also very helpful for the entire physiotherapy and the medical fraternity, as also mentioned by sir, that this is going to give a new way of treating patients and help manage the rising costs and demand, thereby providing hassle-free remote protocol created for every individual requirement. Okay, so uh, I think this is I think this is a way. I have just presented some practical, videos and some pictures I have captured from my own clinic and my own experience dealing with COVID patients. And I hope I have shown you some information regarding how patients are dealing with them, how patients are able to cope up with the situation by using some simple exercises. Because we are here to help them. We are here to easy and simplify the things, because they are going through a lot of turmoil physically and mentally. They are unwell. They are, this gives a, very negative feedback on your mind, that your body is not well, you're not able to cope up and everything. So these are the way that we physiotherapists can contribute and bring the best out of us, and to give the best to the patient, right? So I think we have come to the end of our event, and I'm really glad. And on behalf of Janitri, I would like to thank the entire panelists, Vijay sir, Apurva sir, Pallavi ma'am, for sparing time and giving us so much of information regarding physiotherapy in COVID-19, and especially Rumi ma'am, sharing your experience and providing a platform where we will be coming up with many more such events, and we will be celebrating, and we will be obliged to have such panelists once again joining us. So we are always here for any kind of physiotherapy consultations or anything. We are there. Don't hesitate. Just feel free to connect with us. Okay. So thank you, Vijay sir. It was pleasure having you here as a telemedicine expert. Thank you, sir.
Thank you very much.
Shakti, a very nice presentation. I like the ideas actually, the innovative ideas from you. So Vijay, actually, Shakti will prepare a document after this presentation. So please cooperate. From your topic, if you give some points, so she'll put on her document. So we are preparing the document that will publish it by tomorrow or day after.
Yes, sir. We want some points from
Mother,
you.
Mother
Right.
From your
Shakti, that
presentation.
a very nice presentation. And I was thinking about spirometer. Spirometer, in fact, I dealt with the spirometer with a hi-fi kind of spirometers, which has a battery, and we used it for telemedicine. And that is electronic spirometer we used to blow, and then the data comes to the mobile and then send it to the patient. So that I was thinking, and that when I seen that, I was just quite surprised, and first time I'm seeing that.
Yes, sir.
The
Absolutely. Yes.
simple
There are a lot
spirometer.
of, yes, there are a lot of new machines, new techniques. There are there. We need to simplify them, as I mentioned. We need to simplify this
Correct.
for our patients,
Yeah,
so they can perform this at their own pace, waiting at their home,
yeah, right.
doing the remote consultations, and performing all these things to overcome the COVID-19 symptoms. Right. Okay, sir. Okay, so thank you so much. Thank you to all the viewers who are watching us, and I wish everyone a very happy physiotherapy day, to all my colleagues and everyone. Just keep yourself fit, keep yourself healthy, and have a positive frame of mind. Move forward, and don't hesitate to consult anybody. At least you don't hesitate to consult more than one consultant. You are feel free. You are free to connect with anyone. Now we have a new norm, as we already had discussions. So I would like to end the event here. Thank you so much, everyone. Thank you, Rumi ma'am. Thank you, sir. Vijay sir. Thank you.
Thank you. Thank you, sir.